My name is Nirmala Maharaj, and I'm a physician at CHRISTUS Trinity Clinic Family Medicine. I was actually born in Trinidad and Tobago in the Caribbean. We moved up when I was 4 years old, so I consider Florida my home. I've been there since the age of 4 until I went off to medical school. It's a wonderful place, very cosmopolitan, lots of people, lots of different types of people. So I had the opportunity to get cultured and meet people of different ethnic backgrounds, different religions, and different viewpoints, and grow up just understanding other people. My mom went back to school when she was in her 40s, I think late 40s. She went to college, managed myself, my sister, and her husband as well. You know, you go to work, then you take night classes, you come home, you're still making dinner, you're still taking care of kids, still doing everything, staying up late at night to study. She managed to get her college degree and become a physical therapist assistant. She's also the reason why I became a physician. So just personally, professionally, academically, everything, she is my hero. I chose to become a physician because when I was in high school, I had a family member become very ill. She essentially survived because of the work of a physician, and that physician not only impacted her life, but also impacted mine. And it was a very profound impact. And when I think about the role of a physician and what they can do and the role they play not only in their patients' lives, but in their patients' families' lives, I wanted to have that role as well of being able to help someone, make them healthier, and just try and do as much as I can for another human being, the same way that physician did for my family member. I love the variety of family medicine. In one instance, I could be with an 80-year-old, and my next visit, it's a 15-year-old, and one visit I could be doing a well-woman exam, doing a pap smear and preventative medicine, and my next visit, I'm treating a sore throat. So it's not just the same thing over and over. It's not mundane. It's exciting to me because I don't know what my next visit's going to be about. My philosophy to patient care is to, first and foremost, treat everyone the way you want to be treated. So I really try to understand where a patient's coming from. A lot of people have a fear towards physicians. They can't afford medications. They can't afford doctor visits. So I try to understand their perspective and where they're coming from. And I try to alleviate whatever fears they may have, whether it's about just coming to a doctor's visit, or even their disease process of what's going to happen to them or what might happen if they take a medication. So I try to communicate with them. So my philosophy inherently is just to talk to people and get one-on-one with them. I'm a firm believer in preventative medicine, so I want to keep my patients as healthy as possible by maintaining their health and not necessarily having them undergo a disease process and the adverse effects of a disease process and then trying to fix them or keep them at that point. I want to keep them in their health before they get there.